thank you so much. I have Richard Fernandez and David Hyman, and they're of our beloved hospital, Beth Israel Deaconess Milton. And I'm from the Milton scene. I'm Melissa Fassel Dunn, and we are going to talk today about all things coronavirus and how that relates to our town. So I'm so happy to have you guys here.
We're thrilled to be here. Thanks for having us.
I'm sure you're not busy at all, though, so it's got to be nuts.
Friday afternoon, everything slows down, except COVID. It doesn't.
I know.
Yeah.
Wouldn't it be cool if it took a break and, you know, I don't know, had a cocktail at 5 p.m. and just gave us a little break? So, Rich, you are the president and CEO of Beth Israel Deaconess Milton. Oh my God, it's such a mouthful.
I got it. Just call it BID. BID.
Thank
Milton.
you.
How about that?
God. BID Milton. Easy. And David, you're the chief of philanthropy and communications.
Correct.
Is that right?
That's correct. Thank you.
Mostly?
And other things, but that's the official title, yes.
Okay, great. So can you guys talk a little bit about what it's like at BID Milton now? What's going on?
Yep. So Melissa, first of all, thanks for having us, Dave and I. One of the things we want to make sure we do is give people a peek into the hospitals, Milton Hospital and the industry as a whole, but also first and foremost to thank the people of Milton, this region. What we're seeing in Massachusetts is a direct result of all the hard work and diligence of people learning new terms like social distancing, hand washing, really supporting each other. It's those actions that have allowed Massachusetts, we believe we're in this surge, but we're not going to be overwhelmed, which was the fear. I know everybody in this region, and as a hospital leader, that's the biggest fear, that we were going to get overloaded. But I think as you look at the governor and others, we're still in a tough spot. We're seeing a lot of sick patients, not just at Milton, but across Massachusetts. But we don't believe we're going to tip the scale and not be able to have enough ventilators or ICU beds for patients. So that is kudos to everybody. I would say right here at Milton, it's interesting times. Number one, I would say it's great to be part of a system. We're part of the Beth Israel Lahey system. So one of the ways we've been able to kind of stay at a pretty good level at Milton is because if we have critically ill patients, we can transfer them downtown to the BID Medical Center. We've done that on a regular basis to kind of take the edge off. We've also, as a system, the New England Baptist, the famous joint world, orthopedic hospital, is now basically another medical surgical hospital. So we've transferred patients there. We've also partnered with the city and towns to send patients to the new hospital in Boston called Boston Hope at the Convention Center, because one of the struggles with COVID in a hospital is it's not necessarily COVID the disease, but patients stay longer. So for us to take care of that next patient, we need a safe, good place for that patient, because many of them, after a few days, don't need more hospital level medical care, but they do need a place where they can go and be safe. So being part of a system has really helped us. In addition, it's helped us acquire supplies, protective equipment, share resources. I mean, we pulled 2 ventilators from Plymouth Hospital because we had more of a need. That helps us. So locally, I'll tell you, the picture in Milton Hospital is a little tale of 2 worlds. So we did everything we should to bring down our census and stop doing elective surgeries, endoscopies, screening, office, which is what we all had to do. Every industry had to take a hit for that, but that's allowed us to be ready for the COVID patients. So on some floors in the emergency department, we're seeing about half the patients we normally do, but the ones that come in are definitely sicker, and our staff obviously have to gown up and protect. So it feels busy, but we're not seeing the volume. Up on the floors, our inpatient census is about half, maybe 2/3 now. It's growing, but again, it feels busy because of all the hustle and bustle and protective equipment and doing the right thing. But I will say we've kind of hit our stride early on. It was new, right? It was scary. We weren't sure if we had enough equipment. Our nurses were new. You go up there now, and my feeling is they say, like, we got this. We've got equipment. People know what they're doing. We've worked through all the little kinks. So I'd say we're in a good spot. But on the flip side, for all of our Milton residents out there, COVID has solved the parking problem at Milton Hospital, because the place, it's empty. without people coming to see their primary care or their cardiologist or get their mammography or endoscopy or hip replacement, the parking lots are empty. The OR is virtually empty, and there is, and I know there is a huge impact, not only to patients probably not getting care they want, but financially hospitals we're doing the right thing, but we're all taking a hit. And I know every industry, restaurants, construction, everybody's taking it. So, but I also want people to know that hospitals aren't immune from that either. But the one last message before I know we have a lot of, we want to go, I want to make sure people know that our emergency department, if there is an emergency, if you're having chest pain, dizziness, symptoms of stroke, come to the emergency department. We will treat you. You will not get COVID in our hospital. Our staff are gowned, protected, washing their hands, and we do not want people suffering at home. And that's a big message across Eastern Massachusetts. And we would rather you come in and get you on the front side of whatever that emergency is, as opposed to you suffering at home for hours or days and coming in a much more difficult position. So know that we're still here for you. And before we know it, we'll be back to elective and the kind of new normal. So.
And the parking problem. We're welcoming the parking problem again, right?
Yes. Yes.
Yep.
And I want to go back to, I heard something really encouraging. I actually got chills when you said it, when you said that you think we've gotten ahead of it enough and we're not going to, have to turn people away and make those critical decisions that they had to make, say in Italy. Like we're doing, it's working. You're telling me it's working.
Oh yeah. I mean, we are definitely every hospital in Massachusetts, the number of patients in the intensive care and on ventilators is still going up. And you see it in the governor's report.
Yeah.
Actually, there's hundreds of people dying for the last 7 days. And there will be probably hundreds of people dying in Massachusetts for the next, 7 to 10 days, maybe longer. So we're kind of at that
peak
point. But that peak, because everybody's done with it, that peak gets longer. It's not this where you get overwhelmed. Right. It's now spread out. So people are doing the right thing. And our 3.5 hours away in New York, right? It's not, just Italy. It's right here in our country. Right. People are overwhelmed, not just hospitals, but physicians and nurses and things. So we're very lucky and we're very grateful. We also know that the future will mean us still adapting a little bit so that we never do get in that, because you've probably seen some reports, the winter, we don't want to get back into this, or the fall or other things. So there's a lot of work to do, but we'll get through it.
It's nice to hear a positive message. Really nice to hear that. And because I know we're, like you said, businesses are working hard, restaurants are doing the right thing, hospitals are doing the right thing, and people, right? Like everyday people, they're doing the right thing.
Yeah. And
it's working, which is great. How many, approximately how many COVID patients that do you have right now at the hospital?
Yep. So it ebbs and flows each day, right? We just so you know, and patient and people in the community, until tested, we protect our staff that way. We protect ourselves from patients. So anywhere from 25 to 40 of our patients in our hospital are actually COVID positive, and we try as best we can to segregate them into a couple units. And it's not because the patients are going to affect each other. It's mainly so we can conserve PPE. And so our nurses, literally some of our nurses will stay in their protective equipment for 4 hours or for a full shift. And then they have another team member who gets them their medications, other things. But that way, when you're going into a room, you don't have to take off all your goggles every single time. I actually talked to a nurse one time early on in this, and she was, she's about 3 or 4 years out from nursing school. And she said, Rich, this is so much easier. She said, before we did this team-based care, I went through 8 sets of gowns and PPE for one patient, and she takes care of 3 to 4 patients on an 8-hour shift. She said, we were just burning through this stuff. So it protects our patients, it protects our staff, and it conserves PPE, because PPE is the way you keep your staff safe. And that's our number one job, because without our staff, they can't do what they do best, which is take care of patients. So
this is so interesting too, when you talk about how this sort of new system that you've been forced into, frankly, by COVID, it's interesting, the efficiency of it, isn't it? I mean, do you think it'll affect the hospital going forward when we're kind of over this hump?
Yeah, it's interesting, for this, we know COVID isn't going away. We just know it'll probably get tamped down. my guess is we'll use some of these. And I think it'll just be fascinating to see all kinds of things, right? In the hospital, telemedicine with your doctor. You know, my wife's a pediatrician. She's adapting to this kind of, new normal and but my guess is there's other ways we can use telemedicine, telecommuting, Zoom, and these things that will pull through on the other side, whether it's in healthcare or other industries. So I think it will be interesting.
Yeah. Are you seeing, it sounds like we're not quite there. So there's no evidence right now of a drop in cases, but you do think we're maybe leveling off?
I would say we're at the crest. There'll always be these little micro bursts, but they train us to kind of look at this data over 7 days. So 1 day, 2 day, 3 day doesn't make a trend. 7 days is where you really get, and that's why you always hear with the governor and some of the other recommendations, they're looking at kind of a 2-week trend. So whether it's hospitalizations, ventilators, deaths, cases, you kind of got to look at it a little bit longer time frame.
So we're not quite there yet. I just want to be there.
We're in it. I just don't know if it's probably going to edge up a little bit before it really starts to steadily go down.
Right. So now I just want to take like a quick break. I know you mentioned earlier, if people are not feeling well, don't stay home, go to the ED, get looked at. And that's, I know like you said, for chest pain or even just regular stuff you'd go to the ED for, right? But what are some signs of COVID-19? I know you hear different things. So what are the signs where you're like, okay, here's the signs where I need to call my doctor, and then here's the signs where I might need to go to the hospital?
So again, you've probably read it. I mean, the early signs, and we've added a few as we've learned a little bit, it's still a new virus, right? But like cough, fever, right? Body aches, those are definitely sign and true. Headaches. The other one that kind of is some sort of stomach indigestion, diarrhea, and even losing your taste or smell. We've had of the few staff that we had one staff member. She didn't have a whole lot of other symptoms, but her first thing was she lost her taste and smell. Those generally,
so odd.
Those ones, call your primary care physician. They can help guide you through, and if you can't get the fever down, or if you start to, because this does, and you've seen some of the studies, it does affect your lungs. So if it's shortness of breath, or other things where your airways or body really doesn't feel well. The other one I would just say is use your gut. If you're having terrifying headaches or body aches or chills and you can't control it, call your primary care physician. But if you have a doubt, the good news is there'll be nobody in our waiting room when you come in. Half of them, we're taking care of them. So there's generally people worried to go into emergency room waiting long. You'll get in relatively quick, and we precaution. Everybody gets a mask. Anybody you interact with will have washed their hands and done the right thing. So those are the signs and symptoms. And I know one of the questions you had, and maybe I'll just kind of is this term asymptomatic.
Yeah. Super curious about that because it's so weird.
It's a funny way of just basically saying no symptoms, but you're carrying this virus and you can spread it, which is the kind of eerie thing about COVID. Is that normally with like the flu or something, you start getting a fever, your headache, and immediately you're like, something ain't right.
Yeah.
There are people that have had this virus that had no symptoms and probably had no idea they had it. So one of the biggest fears of that is that if you don't think you have signs and symptoms, are you going to relax some of your other precautions of social distancing, washing their hands, interacting with people in closed spaces? So asymptomatic basically means you either don't have them or you're yet to develop symptoms, but you can still transmit COVID-19. So very important. And that's why this social distancing and washing your hands and wearing a mask in public is important to help, because you may be spreading it without knowing.
Right, which is terrible. I mean, even the whole concept of it.
Yeah.
So in terms of masks too, I don't, maybe you can clarify this for me. I've heard that, the main purpose of the mask is to prevent that asymptomatic person from spreading it. But is there any evidence that wearing one can also help you? And I'm not talking about N95. I'm talking about some of the more,
the surgical
or the cloth ones that people are making. Exactly.
So let me start by saying I'm not an infectious disease specialist, and I haven't slept in a Holiday Inn to be able to tell you that. But here's what I can tell you. So the purpose of the mask, remember, despite what you're hearing, this is primarily spread through droplets, through sneezing, coughing, that then gets on a tabletop or gets on your hands or your arm, and then you spread. It absolutely can spread. The reason the recommendations are for a mask is to prevent your sneeze or cough or something getting someone else. If you sneezed and I was right next to Dave without any protective, there's a higher chance that that droplet could get on him. So the mask is simply you're protecting other people in case you sneeze, cough, or somehow have a droplet piece. So it does not necessarily prevent, and let's face it, I mean, you've heard all this stuff. It's not swarming around in the air. It's a contact. I was trying to think of the analogy. It's not like, I don't know, a grasshopper in the woods can jump off a branch and get to you, but it certainly can be transmitted from one surface to another or from one purpose through contact. And that's why the 6 feet, there's nothing magical about the 6 feet, but part of the theory behind 6 feet is that if I sneezed and you were 10 feet away from me, that droplet would go to the floor in 6 feet or dissipate. But again, we're learning about this. There's some studies, you can find information to come up with all kinds of theories on this, but we honestly just don't know enough totally about it. But we do believe that we know that will protect you, and the 6 feet is another measure to help with distance. So I know in the public it's become a hot issue.
It has. And in terms of even being outside, do you still, or the people you work with, the infectious disease physicians, do you still recommend that they keep masks on? So for example, if people are jogging or walking their dog or playing outside, what are your thoughts?
So I would say, particularly if you think you're going to interact with people, because remember, you want to prevent yourself from a droplet exposure. I wear one anytime I go to the supermarket, anytime I'm going to be coming in close contact with people. I'll be honest, I found it really hard. I like to run. It felt like I was doing altitude training, wearing it over my mask, and I wasn't really ready for that altitude. But runners, there's other ways, runners or bikers, if you're side by side, I'm not behind someone or something. So there's some good literature on that too. So I wear it in anywhere. I think I wear it in the hospital every day now when we're out and about, particularly in patient cares. I wear it to supermarkets. If I'm going to be anywhere close to someone, I would rather wear it than not wear it. I do believe on the exercise, different people have different thresholds, and maybe I just need to get a new bandana, and I can do that too.
And I've seen a lot of people, and I feel like there's a lot of maybe false security. I've seen a lot of people wearing gloves, right? You see people wearing gloves, and they're in the supermarket, right? And they've got their cart, they've got their gloves on, and then they reach for their cereal and they put it in the cart, and then they do this.
Gotcha. Yes.
So what are your thoughts on gloves? Do you think they're necessary, or maybe hand washing is enough and sanitizer is enough?
So let me preface all this, and Dave, obviously you can jump into, but I preface all this that I think the approach that you take, whether it's with your family member or someone in the supermarket or a patient or a loved one or something, the way you approach, education and awareness and letting people do that versus the damning and the, critics, and, that's not going to help anybody. Most people, I'm an undergrad psychology major, most people don't respond well to that. You actually get the opposite reaction. So I would just say for all of our Milton residents and people in this region, being educational, supportive, and knowing people have different thresholds and nobody's right. And but I would say, going back to your topic of gloves are just like your hands. They can transmit it. You don't want to touch your eyes. I've stopped. I remember when this first started, I noticed how much I just touched my eyes.
We all touch our faces like 8,000 times a day.
Your nose, your mouth, all this. And gloves, unless you're washing your gloves, you have just as much ability to transmit as with your hands. Now, your hands are a little more porous, but there's the infectious disease education that I've got. Your nails and other things can hold things a little longer. So there is a level of protection, but if you're going to wear gloves, make sure you're washing your hands just like you would if you didn't have gloves on.
Yeah.
And don't
All
touch your anywhere above your neck.
Which is just becoming so difficult. You know how to your point about, you know, sometimes when you tell people not to do something, they want to do it even more, or they want to sort of have this act of defiance. That's how I am with my face. I'm like, I just want to touch it all the time.
Hey, wash your hands real good. Wash your hands real good, and then you have a little freedom, or do it in the shower. I don't know.
That's a good recommendation. Get all your face touching done in the shower in the morning.
Yeah, get it over
Like,
with.
wash your hair, shave, you know, touch your face. So you've covered so many awesome things here. Is there any research out there yet that's concrete that indicates how long people are contagious for when they have it? So important for when people are both symptomatic and asymptomatic. Do we have, is there anything?
I think there's a lot, Dave. I don't know if you've been how much you've been studying this, but there's a lot of unknowns about how quickly and how people, what they call, shed the virus. I just think it's too early. I don't think we have enough information to have anything conclusive. There's a lot of theories. There's a lot of studies that are perhaps a little incomplete, but I don't think there's anything definitively that we know at this point.
Yeah.
And what about antibody testing? What are your, do you think it's helpful? I know there's a lot of chatter about that as well. What are your thoughts on that?
Definitely. I mean, antibodies will when they perfect it and get it consistent and reliable and widespread, and assuming that the same antibodies like the virus don't allow, like the flu. I mean, one theory is that once you have COVID, if you have the antibodies, then you won't get it again. We haven't been through this long enough to know if that's absolutely true, but they're working hard at that. But that will be a great way. And this is, again, one of those areas where I think the public and government and business, we all have to work together, because to the extent they get a good antibody test, having people and employers and everybody encourage our staff and our patients and people in the community to get the test will help us understand the kind of immunity level that we have. So it will definitely be helpful. I'm not convinced, and I don't think most of the real experts are convinced that it's where it needs to be.
Right. And that test, it's like a flu test, right? Like a nasal swab?
For
Currently?
COVID it is. For the antibodies, it's often most usually a blood test.
Gotcha. Yeah, I got my test mixed up. Sorry.
Yeah.
I was an English major, so forgive me.
Hey, Melissa, if you ever get tested for COVID, you'll never forget of it, because the nasal swab is not a pleasant feeling.
Yeah, I'm hoping to never have to have that test.
Yeah.
Sounds terrible. And so you touched on a little bit earlier, PPE. Do you want, actually, what's PPE stand for? Just in case, because we use this term all the time, right? Some people might not know what it is.
We're 6 weeks into this. No. Personal protective equipment. But it covers everything from masks to what's called PAPRs to equipment they use in the OR. I mean, it covers a lot of things, but most of the public thinks of it as masks, goggles, gowns, those things, swabs for testing, etc. So it has a broad term depending on the audience.
So, and it sounds like right now, Milton Hospital's okay with that, where it needs to be through some, strategy and being extremely strategic with how it's used and conserving.
Yeah. So it's one of those things you can never have enough, and you have to what
like toilet paper.
Yeah, actually, PPE is slightly more important.
You think so?
It wasn't on the early run, but so, and let me explain that, and maybe Dave can talk about some of the creative ways that we've been able to get some of the community support that we've had. But PPE is, you need a steady, high quality, and dependable supply chain of that, right? And we need it now. We needed it as a hospital before COVID for operating rooms and endoscopy procedures. We need it now for COVID in many more units. And guess what? Every other business is going to need some level of this. So I think there's going to be huge disruption, and hopefully some people jumping into this business for producers, but it has to meet the same quality standards, right? At least for a healthcare. For an office building or a restaurant, the standards may differ a little bit, but I think it's going to be a huge issue. And you hear about it when they talk about phase 1 reopening. It's because everybody, if they open up the big office buildings in Boston, they're going to probably want to give people masks depending on how close they sit together, et cetera. So it's a big issue. We as a system have, at least for now, been able to have enough from very early on, and we've had changing protocols, but we still are looking at all kinds of ways to make sure we can conserve it, use it appropriately, reuse it when it's appropriate, and then make sure as we go into phase 1, 2 of reopening that we have some. But I'll let Dave talk. We've had some unbelievable community support right here in this region to help us get our hands on some of this PPE when it wasn't so steady stream. Dave, do you want to talk a little bit about that?
Yeah, and I'm curious also about how do people know the difference between a quality product and a non-quality product? I mean, I've heard rumors, you know, I have a family member who's a physician, and, you know, she said she got like her masks, and she's not at Beth Israel Deaconess, but she was saying how it smelled bad. You know, how do you know? How do you know what you're getting?
Yeah.
Dave, do you want to talk about some of the interesting community support, and then maybe you can touch on that, and I can dive into that last.
Yeah, it's an interesting question. I mean, the community support and has been just amazing. And one of the things we've been able to do, the N95 mask and masks in general, people have come out of the woodwork and want to support us, both at a system level through Beth Israel Lady Health and locally here at BID-Milton. We've had people reach out. We've had thousands of masks donated. And so I think Rich said we're fortunate that we feel like we're in good shape to make sure we're taking care of our patients and making sure our staff are safe. But part of the reason we're able to be in that situation is because of the community support. So, you know, for example, we had actually, you know, hundreds of masks donated through Milton Academy. People associate that recently. So, you know, it's those types of things that we've needed to get where we are, and we're going to continue to need that. So if people are
that's not going away, right?
It's not going away, and as Rich said, that things might level off in terms of COVID, but it's probably going to be with us for a while. And so we want to make sure that we're prepared for now and prepared for tomorrow and the weeks and months ahead.
Yeah, and I would, I mean, there was the Milton Academy, wasn't it Congressman Lynch got us several hundred? I mean, people coming out of the woodwork. I had a good colleague in Quincy who helped us get a couple hundred, and this was like early on when people were trying to shore up the supply line. So it was extremely helpful. And to your point about how do you assess this? I mean, we have both infectious control physicians and nurses. So when we started to get some of this, we really relied on experts to assess it. And you know what? If it didn't meet the A grade, but it met the B grade, you know, maybe we don't use it in our OR and the ED, but we could use it for, you know, as an equivalent to a surgical mask. So we're trying to make sure we put those to use. And I think that will be the biggest challenge for the supply line for the U.S., right, of how do we make sure they're at the same standard? Because one thing what we will never compromise is on the safety and the quality of our, whether it's our mask or our gowns or our surgical equipment. Our staff have to know that quality and safety is number one. And I say that all the time. It used to be about infection rates and other, now it's about our PPE, but we are going to do everything possible, and they need to know if they have a problem or don't think it's right, they need to come to us and we will thoroughly look at it. But I know that's what hospital leaders do across Massachusetts. Nobody wants to use substandard stuff or put it in use, but we're also not perfect, right? We get a box that says all the right things on it, but you know, we're going to push on that because safety is absolutely number one.
And can you tell us, you know, we touched on a little bit earlier, maybe Dave can speak to this, given the number of COVID patients, I know just like kind of every other institution and business right now, you're not having your normal business, right? So can you tell us about how the hospital is affected? You know, for example, like you said, there's not these routine examinations going on. There's not routine procedures like colonoscopies and all that other stuff. So how has that affected the hospital?
Yep. You want to start, Dave, and I'll add a little color. I'll be the color man.
Yeah, well, I think Rich said it earlier. I think it's an interesting time. I think people feel because we're a healthcare provider and people are hearing about COVID and people being sick, that the hospital would be very busy.
Right.
And so the truth is we are busy with COVID patients, and we have our patients coming in the doors, but our normal revenue sources or normal business is much decline. And so surgeries and outpatient procedures and visits to the hospital are down over 50% of what they normally be. So it is causing financial, it's a burden on the hospital financially. And I can go into a little bit more in a minute, and I think we'll talk about how people can help, but we've established different ways that people can support us and get us through those times. But it's definitely affecting the normal business in terms of revenue and patients coming through the door.
Absolutely.
Right. And I mean, we need you guys. So,
Yeah.
And we need you.
So can you, I mean, I don't know, Rich, it sounds like you have some color to contribute.
Yeah. Just, I mean, if people know Milton Hospital, right, we do, a lot of orthopedic surgery, hip replacement, knee replacement. People are putting those off. We do bariatric surgery. We do robotic surgery for, there's patients that we've worked with, we've had to do some procedures because they're urgent and they can't wait. But cancer, I mean, we talk about colonoscopies and other things, but that's cancer screening, right? Our biggest fear of this lasting along is that there'll be some people that, a month might have made a difference.
Right.
I would say, our operating rooms are empty. Like I said, we solved the parking problem. But again, our physicians, they're here for our patients. So I would also just say, most physicians now, one of the silver linings, they're all doing telemedicine. So our neurologists, our GI docs, our orthopedics, even some of our orthopedics, if they need to be seen, we'll still see if they really need to be seen in an office. And we had someone who came in and really tore up their ankle. And so we sent them in to see. So it's not that they won't be seen. It's just, I think the public is still trying to do the right thing and not trying to burden the system. And we want to make sure people know, call your doctor. Chances are they'll do a televisit or a video visit. And if you need to be seen, they'll get you in and take the right precaution. But it's been really tough. The number that I think the Mass Hospital Association across Massachusetts was something to the tune of $1.8 billion a month. It's costing the healthcare system. So we all did the right things. The community, government, businesses, healthcare institutions took their census down so that we could deal with any surge. But it's impacting all of us.
Yeah, definitely. And I know a lot of people in the community, I see it all the time with people in my social media group. They want to know how they can help. But, a lot of us are in situations where maybe we're not in a good position to help, but there are still many people that are still, wonderfully in positions where they can help. So what can people do I know there's donations of PPE if you've got something. What else can people do to help support the hospital?
Yeah, let me talk a little bit about them. First of all, just, for the audience you have in Milton, we just want to say thank you for the outpouring of support and generosity and kindness and compassion. It's been incredible. It's one of those situations when you have crisis that people really rally together. And we're seeing some amazing support and true colors of people that are just rallying around the community and rallying around their hospital and at BID-Milton. So that's been amazing. And so, things happen so quickly that if you look 4 or 5 weeks ago, we were talking about something different completely, right? And so what we've done is when this happened, we actually created something we're calling the Healthcare Heroes Fund. And I hope some people might have seen it. And the campaign really has 3 different pieces is what we see. One is a financial support of it. One is a in-kind donation of supplies and items like masks. And the third is making sure that we're doing everything we can to support our staff, to thank our staff, and help work with the community to do that. It means so much to them. So if I go through those just quickly, the piece we talked about is the financial need is incredible. We're a nonprofit hospital. And as that, we've always relied on financial contributions to make sure we're offering the best possible care to our patients in the community. And so when something like this happens, a lot of our normal plans have been changed or moved. Things like events and galas that we've had been postponed. So some of the sources that we've relied on for financial support kind of went away for right now. And so we established the Healthcare Heroes Fund to make sure that we can continue to do all the work. But quite honestly, we're at a point that financial contributions are more important than they've ever been. And so we've been thrilled with the outpouring support on that. We're trying to give people the opportunity to make donations to make sure that we can give all the resources we can to those frontline staff. So that's what the Healthcare Heroes Fund's about. I will do, if I could do a push on it, that if people want to make donations to it, they can go to our website, BID-Milton.org/Healthcare Heroes. We love to have that support and coming in. And we thank the people that have already have done that. The second piece is around donations of items and supplies. Like we talked about earlier, we've just been thrilled with the number of people that are reaching out, particularly around masks where the needs are. Those N95s, if you have access to them, keep them coming. We set up a drop-off on Tuesdays and Thursdays, so you can come on near our emergency room. You can just pull up, drop your stuff off. You don't have to come into the hospital. It's from 10 to 2 every Tuesday and Thursday. If you want to find out more information, you can go to that same website. It has information about if you have questions, if the item you want to drop off is good, if it's the right quality. There are restrictions such as no open packages and things like that. So it's good to know sometimes before dropping them off. Keep those coming. But we've had outpouring support for people, waters and chocolates and food. Just to give you an example, and I really want to say thank you. The Boston Globe has partnered with local businesses, restaurants, and catering companies. Yeah. And as of starting last week, they are giving free meals 3 days a week, 3 times a day, 7 days a week to all of our staff for completely free. This is a free thing. So our amazing, hardworking staff don't have to worry about bringing in food or getting food. It's from different caterers. In fact, our local, friends over at The Plate, they did burritos this morning, breakfast burritos that were
and I'm sure they were delicious also.
Yes.
Their food is so good.
Amazing. And so there's people like that locally that are contributing, but that's been amazing. We've had 140 pairs of sneakers that were donated to us through a company called Concepts to make sure that everyone has a second pair of shoes that need them. They're on their feet every day. And so it's just been amazing. And we've had people donating gift cards that that are great, that we can give to our staff to either for a meal or something else that they can do. So it's been incredible, the support in terms of in-kind. We need that stuff. It's a great way to kind of lift up the spirits of our staff and really show them how much we appreciate it. So we love that kind of stuff continuing to come in. And then the third piece is we want to make sure that we're able to say thank you to the people that are going in every day. It's a tough situation. It can be scary. These are brave people that are walking through those doors. And when we say healthcare heroes, they really are heroes. And so we've set up things that if you want to send messages of hope and encouragement, you can go to that website, the same one, and you can send an email of encouragement. We've had one of our local Board of Overseers, Stephanie Toomey, who is collecting pictures of people holding signs with their kids that saying thank you. We put on Facebook. They're on all our monitors at the hospital so people to see that. We've had people design cards and send thank you notes. We want those. Keep them coming. It really inspires the staff. And hopefully you've seen also, we started to push along, is that a card, Rich?
Some beautiful homemade cards that were sent. Just unbelievable.
Oh, wow. Those are gorgeous.
They are. Talented people.
Yeah.
And one of the ways we've also been doing is recently, maybe people started to see them around, is we've created yard signs that are basically a thank you to our healthcare heroes on there. We're giving them, what we've done is we've used them as a chance to say thank you. So when our healthcare heroes or people in the community drive by, they see they're loved and supported. What we're doing for that is, it's any donation to our Healthcare Heroes Fund of any size. We're in Milton, we're dropping them off. So we'll drop them off. If you make a donation online and you click, I want a yard sign in Milton, we'll just drop them off on your yard for you. We've had great success. We ordered the first batch, not knowing how many we'd go through. We went through them fairly quickly within about a week. And so we're getting that second order in now. So it's a good way for people to show their support and to help the fund as well if people are interested.
And I think I want to just point out really quickly, because I know sometimes I personally feel this way when I'm asked to donate or encouraged to donate, or I want to donate. I feel like, oh God, it's just not enough. This is not enough. I can't donate. This is pathetic. It's a pathetic donation. Can you talk a little bit about that? Because I know it's a silly feeling, right?
Yeah, totally.
No donation is too small and you're still contributing. I mean, even if it's $5, that's a few masks, right?
Absolutely. Donations of any amount are important for us, and it equals up, it adds up. We're seeing a good amount of donations coming in online. They add up to significant dollars that can help there. And like you said, a few dollars here can purchase a mask. They go into that, and every one of those masks we buy are important, right? And so every piece of equipment we buy is important, and it adds up quickly. We have 10,000 households in the Milton area. You know, small donations from every household adds up to big money. We do need the support of the community here. I'm not going to lie. This is one of those situations that we need the love, we need kindness. We also do need the financial support to get us through this period. So everything I'd ask for any level, whether it's $1, $5, $10, if you have access for larger donations, or quite honestly, if you have companies you work for, or you know local foundations or donor advised funds people are giving through right now, if you have access to that, we'd love to know. We'd love to have some help having access to that too. So every level, at every range.
Right, $5 each, 10,000 members. We could have 50,000 just from Melissa's team.
Right, exactly. No, I've got 11,000.
Hey, let's do it.
11,000 followers. That's amazing.
And
Can I
there's more
make
every day. So
with the donations and the signs, just remember those signs. When our nurses and doctors and janitorial and diet, everybody comes in, they see those. They see those signs driving into work. They see them going home. So to me, that kind of swell of community support, I mean, it gives me goosebumps thinking about it.
Me too.
I know how much it means to our staff, and the little signs that the kids in school or the high schoolers are, all those things really, really matter. We have them.
It truly can make all the difference.
In our units.
You have a bad day, you see a sign like that, it really can flip your day.
Absolutely.
There's a purpose. People are here, and they're doing amazing work, and all the community support really does matter. And
Dave just touched on, sort of business donations and in-kind. So how would people, I know we've got the BID-Milton.org/healthcareheroes website. Is there a contact email or phone on there where people could chat with someone?
Yeah, if you can go on there. We have different people that are helping out with different things. So there's a woman named Rebecca Sandgarden that's helping with in-kind. Or if you want to make donations, all that information is on our website, so you'll know exactly where to go. There's a list of what kind of items we're accepting, which kind of items we're not accepting at this time. But you can talk to someone if you have a question about that. Our phone numbers are on there. If you want to talk to anyone at any time, you can do that. I'll put out there my number right now. If you have any questions, you can reach out to me directly. My cell phone number is 508-208-3182. I'll take personal calls during this time for anything you might have for any of the members.
Thank you so much. Is there, before we get off of our Zoom call and take care of our kids, is there anything else that you want to talk about or mention or think is important? We covered a lot.
No, this has been great, Melissa. I would just add to Dave, in addition to all the venues we talked about there, the other thing we really need this community is when we start to turn the dial back on, we need people to get comfortable to slowly, at whatever pace they need to, that their health care is important. That annual mammography screening is important. That annual physical, that lab work you might have been putting off, right? Those things are important. And we as a hospital, in addition to healthcare heroes and in-kind, that's the biggest way they can support us going forward, is continue to make BID-Milton and BI-Leahy your hometown hospital. And for whatever it is, to see one of our primary care physicians, it's an emergency, a hand, don't put off your health, because if you put off your health too long, and I think about even just the patients that are putting off their hip and knee replacements.
Yeah.
I mean, I've talked to so many of those patients after they've had surgery and how it's changed their life. Even if you think you're holed up at home, if you want to go outside for that walk and your knee is not agreeing with you, this is painful time for them too. So A, thank people for their support. Yeah. B, we really are going to welcome you back. Maybe not totally with open arms, but with our as big of open arms as we can.
Social distancing arms.
Yeah.
Yeah, and I'm glad you brought that up, because I think that's something that a lot of people forget about too, is that just because these might be routine things, they're still important, really important.
Yeah.
You know,
Yeah. No.
so I thank you for bringing that up.
Yep. And the only other public service piece, I would just say this whole thing, whether it's mask, re-entry into businesses or schools, until we have a vaccine, which will be a while, we're all going to individually and collectively have to make some compromises, some and do it with the spirit that for us to get back to the new normal and more normal, I don't like the new normal because I do believe we'll get back to more normal quicker than the new normal, is we have to make little changes, right? I just signed up for the app so that I'll track my symptoms, not just for my hospital, but regionally every single day to help us get through this storm over the next 12 months or 18 months till they have a vaccine. So
and what's that app? What's that app so that people know?
No, I just did it. I'll send it to you and you can get it out to your people, but
perfect.
There'll be a number of these things. And, you know, there's this balance of my infringing on my right. You know what? I want everybody in Massachusetts, in the world, to know if I have signs or symptoms so that we collectively can get back to normal. We're all going to have to give a little bit on this one. And we as a hospital owe it to you to help build that trust that you can come to Milton and you'll get the care you need and you will not get COVID at our hospital, and to trust your physician's advice. So we really appreciate your time, Melissa, and all your viewers. If there's questions, obviously people know Dave gave his number. My email's right on the website. People can call my office, 617-313-1353. We want to hear from you. We can't wait to have people back in the hospital. We need a little more time to get through this surge and make sure it's completely safe, but we're starting to think about that.
All right. Thank you again so much for chatting with me today. I really appreciate it. And I'm going to get everything together where, you know, I'll put that phone number up, the website up so that people, and the app when we get that app so that everybody can check all of those things out.
Awesome.
So thank you again.
Thank you, Melissa. Be safe.